our talk from classroom to community, how students can support pets and people in crisis. So we will be mostly talking about crisis situations involving domestic violence and homelessness. But at least from the RedRover side, and I can imagine the NAP folks would agree with this, that there are many different types of crises that folks are going to face throughout their lifetime. And so a lot of what we talk about in terms of pets, lack of pet programming being a barrier, but also the power of the human bond, I think can really be related to many other different types of crises. But our conversation today is really going to focus on domestic violence and homelessness. I kind of already went through a lot of this. I think that the final two things that I will just say, please be patient with us. We do have quite a few folks who are here with us, and so if it takes us a little bit of time to maybe work out a tech issue that you might be having or getting to your question, just be patient with us. And then something that is always, I think, a great reminder for myself personally, and something I try and share at any talk I'm giving is let's just assume the best intent of our colleagues. We, I think, are all coming to these spaces with the intent of learning. And so maybe we use a different term than maybe somebody else would use or talk about something in a different way. And so let's just call folks into that conversation and assume that they have the best intent coming here. All right? Okay. Tia, I don't think I missed anything else in terms of getting us going, and you're going to talk agenda in a minute. So I think first, really, really briefly, who is Red Rover? We are a national animal welfare organization. We started in 1987. And we're really, focused on bringing animals out of crisis and into care and strengthening the human-animal bond. We do that through a few different programs that I'll tell you about in just a moment. And I just have to say, I said it a little bit earlier, we couldn't do this work without our volunteers and without our collaborative partners. So thank you again to the folks from NAP being here with us. In terms of our program, we have three main programs. The first program is our Red Rover Responders program, and this is essentially a volunteer program. So we have volunteers throughout the US and Canada who help us in a variety of deployments. T is going to talk to you about a little bit more about that towards the end of our talk today. But I will just say that we help with natural disaster responses. We help with access to veterinary care programs. And on occasion, our volunteers will also help us create pet housing spaces at domestic violence shelters. So we'll tell you more about that. Over on the right is our Red Rover Readers program. This is where essentially we help teach kids about kindness, compassion, and empathy for animals and people through children's books and the Kind News magazine. We actually have a wonderful presentation coming up on our Don't Forget the Pets platform. I think it's going to be next week. We'll make sure that we share out that information for you. But the Readers team is going to be coming in and talking about compassion and empathy. So wonderful talk coming up. And then finally is our Red Rover Relief Program, which is really what brings us here today with you all. On one side of relief are our urgent care grants. And so we can provide small grants to help cover the cost of emergency veterinary care. And then on the other side is all of our domestic violence work. So our grant programs, but also all of the training, technical support, and assistance that we provide to organizations to help them create the kind of programming that we are going to talk to you about today. So in a nutshell, that is Red Rover. That is our elevator pitch. I feel like it gets longer and longer every time, Tia. But I believe now, Tia, you're up to talk a little bit about Domestic Violence Awareness Month.
Yes, thanks, Katie. So Domestic Violence Awareness Month, also used by the acronym DVAM, is an annual observance during the month of October. Domestic Violence Awareness Month is not only dedicated to raising awareness about domestic violence, but also remembering those who have passed from domestic violence as well. We use this as a time to teach folks about what domestic violence looks like, how they can support themselves and their families during times of crisis, and including helping out friends as well. I know this is an area that is often covered at universities as well now, which is really great because we know that this is something that can happen to anybody. Activities throughout the month include educating the public, providing support and resources to survivors, and various campaign awareness building teachings like we're doing today. Thanks, Katie. This is our quick little agenda for today. We'll start off chatting about the link between family violence and pets. We'll talk about the power and control wheels. We'll dive a little bit into experiencing homelessness and how that connects with domestic violence and pets. And then we'll also dive in deep about the human-animal bond. We'll jump over to the interconnections between domestic violence, pet care, and healthcare, which is really why we're here today talking to you all. We'll look into how folks identify abuse and respond to it. And then we'll look into trauma-informed care practices and veterinary social work. Lastly, we'll cover pet housing programs, which is a lot of what we do at RedRover. And don't forget the pets, which is helping human service organizations and animal services create programs that help pets in crisis.
Thanks, Tia. Uh,
Thank you.
I'm going to move forward and let folks start answering this question. And just preface again for anybody who kind of came in a little bit late. Tia and I are going to really just give an overview. We're the 30,000 foot folks. We'll talk about some of this stuff, and then our friends at NAP are going to go a little bit deeper with you. So that's also to say we may speed through some of the information on some of the slides. We wanted to keep those slides in there for you all because, again, you're going to get those slides after the fact. And so we want you to have the information if you want it. But just know that we might go through some of them a little bit quickly. We told you a little bit about RedRover. Now we would love to get to know a little bit about you. So, what is your course of study or profession? And I know I could not include all of the potential courses of study that might be with us today. So I tried to go with just sort of the big ones. So occupational therapy, social work, speech pathology, veterinary medicine, other healthcare, or just something else that is not listed here as well. So really, really great to see who's in the room. The vet med folks, they're coming in strong right now. We'll see. We'll see. And I know that we still might have some folks who join us a little bit late too. We just had occupational therapy take a little creep up, and social work folks. I love seeing you all here. I'll just pause a little bit longer and let some folks respond. And I'll share that prior to my experience coming to RedRover, I came from social services. So I'm not a social worker, but certainly worked in social services, primarily worked with families who were experiencing or at risk of experiencing domestic violence and homelessness and other crisis situations. So, super excited that y'all are here. Things are creeping up. All right. So, with that, I'm going to go to our next question. What brought you to your course of study or profession? So, a little bit of an open-ended question. And no, it could certainly be a long answer to this question, but maybe just share with us in a nutshell what brought you to studying what you're studying or brought you to your current profession. Because again, I know that we have mostly folks who are students, but I believe we also have some folks who are already out into the workforce. I love it. Animals, no surprise. Helping others, desire to help. Hippotherapy. Is that as in hippo, the animal hippotherapy? Because if that is amazing. I love it. We have a couple of responses in the Zoom chat as well. Another, yep, Cindy for hippotherapy. All right. Equine substance abuse and domestic violence. My passion for helping survivors of DV. Be a productive member of the community by any means. Take a look back over here. We'll scroll down a little bit. social justice, a lot of wanting to help others, vet med, caring for and comforting people and animals in need. All right. Helping homeless keep their pets. All right. Was never a choice. I was a teacher who wanted to do more and became an advocate. Love it. Supporting recovery and empowerment, engagement. All right. It's wonderful to just kind of hear in a nutshell where you all are coming from this work. I would have to say, not really any of this is surprising. I'm absolutely going to go look up hippotherapy after this. That's going to be my number one task after this. Love it. All right. And then I think we had just a couple more, maybe just another response in the Zoom chat. Okay. Next. Oops, so sorry. There we go. Final question that we're going to ask you for now, and I'll give a little context around this too. Are you already connected with an organization doing this kind of work? So when we say this kind of work, it is very generally supporting people and animals. You all are obviously coming from sort of different sides of this. But if you are connected to some sort of an organization or a project that is supporting this interconnection between people and animals. So we have a few yeses, a couple no's, and a whole lot of not yet. I love it. Hopefully you're in the right place then if you said not yet. We got a few more yeses in the Zoom chat as well. I'll let this keep going for just another minute. And I will apologize for my voice. I apparently have that cough that just does not want to go away. And so the more I talk, the more husky my voice gets. So here we go. All right. So we have a few more not yets. Loving it. Okay. And 11 yeses, 6 no's. Awesome. Well, thank you all for sharing a little bit about kind of what brings you to this space, what brings you to this conversation. Love seeing all the folks who are already engaged in this kind of work or are hoping to engage in this kind of work. You're absolutely in the right place and glad to have you as part of this discussion. So, as Tia said, we're going to talk really briefly about the link between human and animal violence. First, I did just want to call out, what is domestic violence? Essentially, domestic violence is a pattern of behavior where a person is using that behavior to gain and maintain power and control over an intimate partner. So, domestic violence generally occurs in the home. Um, Generally, when we think about domestic violence, we are thinking about intimate or romantic partners, but domestic violence can happen between siblings, it can happen between parent and child. But the domestic violence piece is that essentially it's happening in the home. Over here on the right is the power and control wheel. I know that that's probably very tiny for you all. And many of you are probably also familiar with the power and control wheel. This came out, I believe it was in the 1970s. It's called the Duluth model. And really, what they did when they created this graphic is they wanted to show what domestic violence or what power and control looks like within a relationship. So it's a wonderful tool. It's been adapted many, many times, and it's actually been adapted to show animal abuse in the context of domestic violence, which I'll show you here in a few minutes as well. I'll also include the website where you can actually get that adapted power and control wheel. But again, many folks are probably used to seeing this power and control wheel. It is something very common in the world of domestic violence and intimate partner violence. Absolutely, Margaret. So, how prevalent is domestic violence? The National Coalition Against Domestic Violence actually just shared new numbers. So, this 12 million number used to be 10 million last year. I just happened to notice on their website that they increased it to 12 million. So, 12 million women and men experience domestic violence in the United States every year. And roughly 24 people are physically abused by an intimate partner in the United States every minute. And we also know that 1 in 3 people of all genders experience domestic violence in their lifetime. And I do want to call that out. Domestic violence is something that is experienced and perpetrated by all genders. A lot of times when you hear conversation around intimate partner violence, IPV, or domestic violence, DV, conversations tend to kind of lean towards a male abuser and a female victim or survivor. But this is something that absolutely affects all genders on the abuser side and the survivor side. You will also hear myself and Tia use survivor language instead of victim language. A lot of times those can be used interchangeably. Some folks do use victim specifically and survivor specifically. We tend to use survivor just because it tends to be, I think, just a term that kind of encompasses everybody and also kind of reflects back on the fact that even if a survivor is still in the relationship or in the home with the abuser, they are still surviving. And so we want to empower survivors in that way. So just know we intentionally use that language, survivor, and we'll continue to use that throughout our time together. What is the link? So this is where I want to touch briefly on this link between human and animal violence. The link was really documented or started to be documented back in the late 1990s. And it was where we started to show, research started to show that there is an interconnection between the four things that you see in the bubbles on the screen. So, child abuse, animal abuse, domestic violence, and elder abuse. And so, generally, the idea here is when one of these things is happening in the home, uh, there is the possibility, the likelihood that one of the other things will be happening as well. For us in particular, we're going to be talking about, of course, animal abuse and domestic violence. I think Phil Arco, who is the coordinator of the National Link Coalition, said it best when he said, when animals are at risk, people are at risk. When people are at risk, animals are at risk. That is really what the link between human and animal violence boils down to. And I really, really encourage you, if you haven't been to the National Link Coalition, definitely go there. You will see just a plethora of information, a lot of the foundational research that came out again late 90s, early 2000s that really helped us to start bring light, I think, to this link between human and animal violence. Speaking of that foundational research, oh, one's out of order, so sorry. 71% of survivors who had entered shelter, predominantly women who had entered shelter, shared that their abuser had threatened to harm, had threatened to, sorry, had threatened, harmed, or killed a family pet. All right. So I want to call out that these were pretty small sample sizes because remember I said that these were survivors who were already in shelter. So their sample sizes were maybe 15, 25, 30 survivors, mostly women who were in shelter. So a very small subset of what it means to experience domestic violence, but still a large number of survivors who said that they had pets who were experiencing violence. Okay, so 71%. I want to call out this survey for you, PALS report. It was released, I want to say, in 2021, and it was a joint effort between the Urban Resource Institute in New York City, one of the largest providers of domestic violence resources in the country, and the hotline. And they essentially surveyed 2,500 survivors who were contacting the hotline about their experience of experiencing domestic violence and animal abuse, right? So 2,500 people. It's a much larger sample size. And it also, I think, gives us more of a holistic view of what it means to experience domestic violence and animal violence, right? So, roughly half of those survivors reported that the threat of harm to pets was a worry to them. 76% had noticed changes in their pet's behavior. This is going to be really, really impactful and I think helpful for our veterinary folks to see this as well. 76%, right? Pets' behavior had changed. 37% of those 2,500 people had said that their abuser had threatened to harm or kill a pet, and 29% said the abuser had actually harmed or killed a pet already. So, again, pretty high numbers of folks who have their family pets being harmed or abused within the context of domestic violence. And I am so sorry. I'm going to go back. Yes, this is the correct one. So remember I said that there was a adapted power and control wheel. So this is it. You can get it at the duluthmodel.org/wheels. So that's where all of their adapted wheels are located. You can download it. So this is a lot like the original power and control wheel, but this calls out specifically what animal violence might look like in this context. So there are a couple of things, and again, I know this is really tiny for you, but there are a couple of things that I want to call out that are listed here that are going to be really important for you all to know as you're entering the workforce and interacting with people and animals who are experiencing violence. One, an abuser may never allow the pet to go to the vet. May never allow the pet to be groomed, may never allow the pet to be socialized, to go to the dog park, go to obedience. And so you may be, whether you're coming from the human side or the animal side, you may be interacting with pets who are not groomed to the same standard as you, who have, again, never been to that vet, may need some of the basic veterinary care like vaccines, may also have behaviors that are a little bit challenging. And so it's really, really important that we, before we jump to the judgment of saying, hey, this might be a bad pet or this might be a bad pet parent, it's important that we stop that judgment and think about, is there something else that's happening or could be happening in the home, which I know our folks at NAP are going to talk more about and Tia as well. Um, that's, I think, one of the biggest pieces to pull out. There may also obviously be physical harm that pets are experiencing, and remember that changed behavior piece as well, right? So again, just some really important things to call out when we're interacting with people and pets experiencing this. Before we jump to that judgment, let's think about what else might be happening in the home. I did want to touch a little bit on experiencing homelessness. There is a strong connection between people experiencing homelessness and people experiencing domestic violence, which I'll go over on the next slide. But just to talk about homelessness in general, uh, 2024 point in time count. If you're not familiar with a point in time count, they happen in communities all over the country. And it's essentially where local groups, local volunteers go out and attempt to count the number of people experiencing homelessness on that one night. 2024 point in time count found over 770,000 people experiencing homelessness in the United States. That was an increase of 18% from 2023. Okay, that's a pretty big increase. Um, Also, I do just want to point out it is really, really challenging to count the number of people experiencing homelessness by itself. It is even more challenging to count the number of people experiencing homelessness with a pet. Best guesses say about 25% of people experiencing homelessness do so with a pet. There are many, many benefits to experiencing homelessness with a pet, which I think I'll talk about on the next slide. It's not on there, so sorry. But I do want to just call out that, people experiencing homelessness with a pet share that, they have so many social, emotional, and physical benefits to experiencing homelessness with a pet. It can mean that this is the only emotional attachment that they have to another living being. From the social standpoint, it may be the only reason why a passerby even acknowledges them being there on the street, because the passerby is, chatting with them about their dog, or acknowledging that they have that pet with them, that cat, whatever that animal might be. And from the physical standpoint, that can mean that, and oftentimes what you'll hear is a person experiencing homelessness says, it's the only way I can sleep, because I know that my pet is there to let me know if somebody is nearby or if I might be in danger. Okay, so there are many, many, many benefits to experiencing homelessness with a pet. When we think about the interconnection between homelessness and domestic violence, 80% of women with children who are experiencing homelessness are survivors of domestic violence. 57% of all women experiencing homelessness state domestic violence as the primary cause for their homelessness. And 45% of all survivors of domestic violence report that they have stayed with an abusive partner because they did not have an alternative place to stay. So there's a strong correlation between homelessness and domestic violence. And then I do want to go back to this last stat down here on the screen. In 2016, so we're going back a few years now, even then, 22% of folks who were a part of this study said that they avoided entering shelter because they couldn't take their companion animal or their pet with them. So even in 2016, this was an issue. And so I would make a guess that that number is probably even a little bit higher right now. Okay. So, my next question for you, and please answer truthfully. You do not have to say yes just because. But if you have a pet, do you consider them to be a family member? And again, there's no judgment if you say no. We've got a couple of responses. There we go. We got to know. I like it. We got a couple of yeses in the Zoom chat. And I love it when we ask an alternative question in some other presentations. Do you? I think it's like very basically, do you like interacting with animals? And we usually have somebody, at least one person, who will say no. And they're my favorite folks to have in the room because you don't have to love animals. You don't have to be an animal lover to understand that lots of other folks, as you can see, do love animals and do consider them to be a member of the family. And so it's really important that we do recognize, yes, a lot of people consider their pet to be a member of the family. And so when we don't have pet programming for our folks coming through human services, we're creating a barrier to service. So 39 said yes, one said no. Pew Research, I think it was Pew Research, said 95%. I've seen some surveys as high as 98% of respondents saying that they consider their pet to be a member of the family. Uh, a lot of folks do consider their pets to be a member of the family. Look at that. Madison even shared a photo there with your pup, and I love your sweatshirt as well. I'm pretty sure that's a Pets for Family sweatshirt, Madison. Love seeing it. All right, so that's kind of the unscientific part of the human animal bond. The scientific part of the human animal bond. One of my favorite organizations around this power of the human animal bond is HABRI. So, the Human Animal Bond Research Institute. There's a lot of great information. I think, especially coming out right now, it's exciting to see all of this research and information around the human animal bond. I think HABRI is a great place to start. I'm not going to go through all of these stats on here just for interest of time. You will have links from the slide deck here as well. But I do just want to point out that 89% of pet owners say they have a close relationship with their pet. 89%. Right now, my two dogs are laying over there at my feet, hanging out with me, and they love hanging out with me for the day, and I love hanging out with them. We enjoy having a close relationship with our pets, right? The other stat that I will call out is the other 89%. So 89% of pet owners say they've experienced the mental health and or physical health benefits of the human animal bond. So we're going to talk a little bit more about that. Science tells us all of this amazing stuff on the screen right now. And I know it's small for some of you, but I do just want to call out just a few different things. 67% said my pet makes me feel happy. 51% said my pet comforts me when I'm feeling sad. 48% said my pet has made me feel less lonely, right? So our pets make us feel mentally more healthy. They also, help us from feeling less lonely. Habry also released some research recently. I think it was their spring forum paper where they really called pets a social conduit, right? So we like interacting around our pets. You all had fun, at least it looked like you were having fun, sharing the names of your pets when you joined us. I can also share that I've lived in my neighborhood for 5 years. I knew all the dog names first who are being walked around the neighborhood. I now know the people names attached to them, but I knew all about those dogs first. And we enjoyed conversating over the dogs. And it was a wonderful way for me to get to know my neighbors. Finally, the last thing I want to call out on this slide is the 43%. So 43% said caring for my pet gives me a sense of purpose. And we hear that a lot. We hear from a lot of people who say, I have trouble doing for me, but I can do for my animal, right? And so I think that's a really, really great piece to take into this kind of work. The Pet Effect, they have some wonderful infographics on the HABRI website, Human Animal Bond Research Institute. Just wonderful infographics. We've got a couple of just pictures that we'll show you. But science tells us that pets improve our heart health. They relieve our depression symptoms. So sorry. They increase our overall well being, they support child health and development, and they support healthy aging. So there are just so many positive impacts of the human animal bond. I will also say that I think it was the Virginia Commonwealth University, released a wonderful paper on the impact of companion animals or pets on trauma and how they can help us heal from trauma. Again, this is just a lovely infographic that I believe, Tia, you got this from the Pet Effect part of their website. So you can get it there. 90% of doctors believe that there are health benefits to owning a pet. 97%. That's a lot. It's a lot of doctors. Pets with patients. So percentage of doctors reporting moderately to significantly better relationship with staff, 76%. Physical condition, 88%. Mental health condition, 97%, and then mood or outlook 98%. So for those pets, for those patients with pets, we see just a lot of just amazing benefits there. Tia, I think we might have taken it out, but I want to say that Habry estimated a $250 billion savings on healthcare related to the human animal bond. I'm going to check my facts while you're chatting, but I think it was a $250 billion savings in healthcare related to the human animal bond. So that, in a nutshell, is the link between human and animal violence. The last two things I will say before Tia starts talking about the intersection of domestic violence and veterinary medicine, two more stats for you. So 97% of those 2,500 respondents in that PALS report said that keeping their pet with them factors into their decision to leave. So 97% said not having a pet program or a pet resource is a potential barrier to leaving an abuser. And at the same time, 91% of those respondents said that their pet plays a significant role in their ability to heal and survive. So we clearly see that not having supportive programming that recognizes the human animal bond creates a barrier to service, and we're also missing a really valuable tool in helping folks to find whatever their success is. So with that, Tia, I'm going to toss it over to you.
Great. Thanks, Katie. It's always really interesting hearing about the ways that the human animal bond and pets help people, not just physically, but emotionally, mentally, and then bringing that all together um, for the entire person. So I'm going to jump into domestic violence and how that intersects with veterinary medicine. I know we have some folks here today in school learning all about this, and folks who are already in that profession, whether you're a veterinarian, vet tech, vet assistant, shelter manager, kennel attendant, anybody and everybody who helps people and their pets, which is a pretty unique position to hold in healthcare. So we'll talk a little bit about what domestic violence looks in real life when you're actually in that room with your patient and your client. You'll notice issues with injuries potentially, a delay of treatment, inconsistent explanations, and additional pets with injuries. But to go into this a little bit deeper, When we talk about treatment delays, we mean suggesting, a course of action for a pet. Maybe they need to start this medication and then come back in for another round or a different medication, but then they delay coming in for that next treatment. Inconsistent explanation. So perhaps you're seeing an injury and the client is saying one thing, but based off your experience and your background that that's not quite adding up. Typically, when we see cases of domestic violence, it's not just one of these issues, it's multiple together. So maybe you're seeing a pet parent who's delaying their treatment, but they're also offering some odd explanations for the injuries, and you're noticing that they have other pets in the home who are experiencing some difficulties. Typically, it's more than one thing happening at the same time, and so you use your best guess, but you also have your background and your experience to hold up how you feel. From abusers, Katie chatted about this a little bit earlier, but it's a big way that abusers will hold power and control over the survivor. This can be threatening the pet in the home or actually physically harming the pet. It can be threatening or harming the pet and then blaming that on the survivor, or sometimes children in the home are blamed. Refusing food or veterinary care. Um, this is what we talked about a little bit earlier about perhaps you'll see a pet patient come in and their care quality isn't what you would recommend, or perhaps isn't how you're used to seeing that pet. Maybe this is a pet that you've cared for some time at your practice, but all of a sudden you're noticing some issues with grooming, or they're really late on vaccinations, that sort of thing. And then denying the survivor ownership. So there are some abusers who will refuse to let the survivor go into the clinic with the pet or have any of the paperwork in the survivor's name. And that is a way to help keep that pet in the home, and cause the survivor to delay leaving, because there's legal actions that can be taken if you were to take a pet out of the home and there's ownership issues and paperwork is in the name of the abuser. So that's a really big area that we try to counsel vet clinics on and animal shelters, is to get that paperwork in the survivor's name. So how should veterinarians respond, or any veterinary professional? I know a lot of veterinary technicians work really hands-on and one-on-one with pet parents. You start with asking, are there any safety concerns at home? Are there any obstacles to providing care for the pets in your home? How are your family members' relationships with your pet? How are your children's relationships with your pet? This is an area that it's really important to be connected with your local human services organizations, especially your domestic violence shelters, your children's services, family justice centers, because they know how to ask these questions. They know the way to ask them and where to ask them, that sort of thing. And so getting that understanding is super, super important for yourself and your staff. Once you ask those questions, you also want to be ready to provide some action. How can you help the survivor if they're letting you know that they're actually not safe in the home, or they need some type of support to help care for their pet? We recommend having an action plan ready. This is something that you create with your entire team so that everyone's in the know if something were to occur. I know that there's some videos on the internet of situations where a survivor has come into a veterinary clinic and slipped a note saying, "Hey, I don't feel safe. I need support." And then seeing how the people who were working at the clinic were able to respond to that. Having an action plan already ready kind of takes out some of that nervousness and some of that, feeling like you're not sure what to do, because, hey, we're already ready. We have this step-by-step guide of how to react and how to respond when someone lets us know that they need help. Setting up code words. I don't know if anyone has heard of an angel shot at a bar, or it could be a beer at a brewery where it's basically ordering something like an angel shot, and that is a code for I need help, or I'm, on a date with someone and I don't feel safe, or I'm with a friend and it's not going well. I've seen this sort of thing in bathroom stalls, or a lot of times it'll be hung in private areas like that. So that is something that we recommend for domestic violence shelters and animal shelters and veterinary clinics, is having some sort of information posted in the bathroom, posted in a kind of safe space away from others, and then also creating those code words so that you can really clearly and efficiently alert others that there's an issue. And then our last little area here is awareness. So immediately suspending judgment. This is something that we kind of talked a little bit about at the very beginning of this presentation, is believing the best intent. And it goes the same when you're talking with clients, or people in the community, is suspending your judgment, starting out with the best intentions and believing them, not minimizing what they're saying, not really putting yourself into their shoes at all, but just being there to listen and provide support, responding with care and empathy. Mandatory reporting. So I know this is a really, really big topic, and certainly not something that we'll be diving into today. But it is something to call out, especially for folks who are in school right now. And this isn't something that's just focused on those in the veterinary field. This is just about everybody who's working with some sort of vulnerable population, whether that's seniors or pets or children, folks living with disabilities. A lot of people have to be very well versed in mandatory reporting. But we have heard that this is an area that isn't touched on super deeply throughout schooling at veterinary universities. At least perhaps it's not widespread in its teaching. So it's something that we really, really stress our animal and veterinary partners to know what the legislation is where you live, know when you're supposed to report and what you're supposed to report about. Um, the laws and requirements in your states do change. It's something that we try to keep up on so that we can help let folks know, but it is something that changes often, and so it's important to be prepared in case you do come across a situation of suspected cruelty or abuse. Thanks, Danielle. Okay, another question for you. Who should veterinary professionals connect with in the community to help survivors? Feel free to put it in Menti or in the chat. Great answers. Everyone, I like that one. Shelters, social workers, definitely law enforcement, absolutely. Excellent. Experts, school districts, that's great. Shelters, great answers. Food pantries, nice. Okay. Those were some great answers. I feel like we need to add a couple more to this slide. We have domestic violence shelters, family justice centers, children's services, law enforcement, animal control, and local community service organizations. But I think my everyone's answer was great, but I think my favorite one was probably everyone, because just about everyone interacts with people and pets, even if it's in a way that might not be direct, right? We know that the so many people have pets in this country, and not only do they have pets, but they care very, very deeply for them. And it's something that is a part of their everyday life. So now we're going to jump over a little bit to the connection between domestic violence, pets, and social work. I know we'll have some folks from NAP diving deeper into this in just a bit, which I'm really excited about. But we're going to do a quick little overview. So, social workers can support and advocate for DV survivors by providing a whole host of resources. They can provide counseling and therapy. They connect survivors to emergency and long-term housing, legal aid, financial assistance. They also advocate for policy initiatives, and they work in collaboration with state and local stakeholders. There are social workers who specialize in domestic violence and interpersonal violence. And in this area, there's a lot of work done to help folks create safety plans to go from being in the home to leaving and seeking safety. And then they're also taught how to establish healthy boundaries. And this is also an area where they chat with folks who, even if they haven't experienced domestic violence, it's something that they coach folks on so that they know how to spot it should they encounter it. Veterinary social work. So this is a part of social work. It's for folks who they have their master's in social work and then they go on to get another certification specifically in veterinary social work. And this combines social work and veterinary medicine. Um, as far as I know, the vast majority of veterinary social workers work at animal shelters and veterinary clinics. But you will see them working in other areas as well. It's a quite interdisciplinary field. So they work with and aid in communication between veterinary and medical professionals, animal owners, and animal shelter staff through 5 areas. Animal related grief and bereavement. So a lot of veterinary social workers will counsel and support families when they've lost a companion animal. Um, they'll also help with hospice treatments and be there during that time. We also have veterinary social workers who work in animal assisted interventions, who help train therapy animals, service animals. I know that's a really big area, and there's such a wide variety when you're talking about emotional therapy and service animals. So that's a big area that social workers work in. Intentional well-being for animal-related professionals, so folks who work in the animal welfare space and providing support for them. Environmental impact of the HAR, human-animal relationship, and the link between human and animal violence, which is what we focus on quite a bit at RedRover. And don't forget the pets. Trauma-informed care. So this is an area that social workers specialize in and veterinary social workers, and a field that is growing and being used in a lot of different areas. It's an approach to healthcare and other services that recognizes the widespread impact of trauma, and it seeks to create safe and supportive environments for people who have experienced trauma. So once you are in a conversation with someone and you ask them about what they've experienced, being able to move forward in that and provide an environment where they feel comfortable talking and moving forward in a positive manner. collaboration in healthcare. I know our NAP folks are they're the experts in this section, so I'm really excited for them to come up soon. But we talk a lot about not just collaborating between human service and animal services, but what that looks like on a broader scale. So human healthcare, social workers, and veterinarians and other veterinary professionals, even though a lot of times they're doing seemingly very different things hands-on, right? There's a big difference between providing, counseling versus, um, doing surgery versus working with animals. But at the end of it, everyone is working to protect public health. And to protect public health, you have to work together. You have to understand what other folks in healthcare are doing and how you can support them because it is connected. Awesome. Thanks, Katie. I think I'm turning it over to you to chat about pet housing programs.
You're welcome. I hope I advanced your slides at a reasonable pace.
You did excellent.
Good,
Thank
good.
you.
Yeah. So I'm going to chat just really kind of briefly about the pet housing programs. And because a lot of what we do at Red Rover is certainly provide training and technical assistance, sort of similar to what we've been doing here with you all today, with sort of an overarching goal of creating more pet housing programs so that essentially people and pets can find safety and healing together, whether they're experiencing domestic violence or homelessness. So, again, I'll keep this really brief, just in interest of time. But we do try and create these pet housing programs. They can look really, really different. It really depends on individual communities, individual organizations, the space that they have. But we generally break it up into on-site and off-site housing options. So on-site options are essentially where the pet parent and the pet are staying at the same location, at the same shelter location. It could be in room, with that person, like in the exact room that they're in. It could be on site in a different space. Maybe they are able to renovate a closet, or create a separate building, usually a small building, where pets can stay. But the important thing here is that pet parent and pet are in the same space. And so we're not sort of separating or breaking apart that human animal bond physically. The other options that we tend to work with are offsite housing options. So generally, those fall into two different categories usually. It may be that the pet is going to stay at the partner animal shelter or at the vet clinic or at a boarding facility. Or we often see a lot of fostering options as well. And so generally, it will be that the domestic violence shelter, the homeless shelter, is working with their animal shelter partner to create that sort of fostering program. Again, a lot of different ways that this programming can look. We really try and help organizations and communities make it work for them because we know that each community is going to have some different needs, and some different situations. This is just a picture of a pet-friendly room at a domestic violence shelter. These are some of our most fun projects to be able to help with, because sometimes these spaces aren't big, and so we need to get creative, but it's also just kind of fun to plan for pet enrichment, right? So here you see some cat enrichment. For any of our cat owners and cat lovers out there, you know that they like to get up high and they like to get away from us. And so, creating pet housing at a shelter, at a human services shelter, can be really, really simple. It can be as simple as creating some cat enrichment in a room. Dogs can be sometimes a little bit easier to work with. This is an example of a cat colony room. This is in Sojourner Center in Phoenix, Arizona. This is a larger project. I'm not going to lie. The sticker price for this one was a little bit bigger. We did this one with our partners at Greater Good Charities. This is a room, like a very large living room. And they wanted the cat colony style. These cats can actually go inside and outside to a catio. And then as you can see in the background here, I don't know if you can see my cursor. But really important piece of this is that they have acclimation areas as well. So cats, when they come in, they have some time to kind of stay away and get acclimated to the environment before they're kind of released out into the cat colony room. So again, we don't do a whole lot of those. This was a bigger shelter, so they had a larger number of cats coming through, and so this is the style that they wanted. Not every shelter is going to need a cat colony room because they just aren't going to have the number of cats coming through. And then this is definitely a different style. So this is actually at a animal shelter organization, I believe. And so the thing to call out about this, because this essentially looks, like animal shelter kennels, right? The important thing when we're thinking about housing pets, whether it be an animal shelter or a boarding facility, is that they not be within the public eye, right? So they're not going to be on the adoption floors. They're not going to be where the general public could just kind of cruise through and see what animals are there. You just never know when somebody's mother's brother's best friend of the abuser is going to come through that public space and potentially see that pet. And so we do need to be really, really careful about that. I will answer that question. I saw it just pop up. Is this set up at most DV shelters? You will see some DV shelters or homeless shelters, human services shelters use a kennel setup like this. They'll have like a separate space so they're not in room with the pet parent. They'll be in a renovated space, or we often will use sheds. Actually, we'll renovate sheds to be climate controlled, and you will see kennel set up like this. There are pros and cons to any of this kind of sheltering. Um, it can be really, really helpful in some ways to kind of have your pets in a separate space, especially if you have multiple families in one room, like multiple human families in one room. You may need to do this kind of setup. I will also just point out one of the cons of this. This can be really expensive if you're a human services shelter to build this. And you are also, again, while you're still on site at a DV shelter or homeless shelter, you're still creating that physical break for the human animal bond. And some pet parents are just really, really going to want that. So again, pros and cons to all of this. We'll talk a little bit more about this when we talk to, or the support we provide around this when we talk about Don't Forget the Pets. Okay. Um, why are they important? We kind of talked a little bit about this earlier when we talked about the link. Essentially, when we create programming that recognizes the human animal bond, we're removing that barrier to safety and healing, right? And we are also supporting that human animal bond, which we've talked about is really, really beneficial to our emotional health, to our social health, to our physical health. And so, really, I can't say it enough. When we recognize pets and people together, we're able to provide holistic care. I think the other way that I sometimes will say that is we can't help people if we don't help animals, and we can't help animals if we don't help people. We really are interconnected. And so I think to really provide holistic, trauma-informed, survivor-centric services and care, we have to recognize both. But with that, we also know that there are a lot of barriers to it. I mentioned earlier that I come from the human services world. So I know how scary it is when I say to a domestic violence shelter or homeless shelter, hey, you know what I think you should do is incorporate pets into your programming. I know it's scary. And from the other angle, when we say it to an animal organization, I know it's scary as well. And so, what I would just call out, I think, from that standpoint is one of the most important things, and what Tia and I have been talking about, and what the NAP folks are going to talk about is you don't have to do it alone. You don't have to be the expert in everything. And I think that's one of the most important pieces to this work. So just really understand that we don't have to be animal experts. We don't have to be human experts. There are so many assets and resources in our communities, and we can overcome a lot of these challenges when we work together. I'm gonna just skip this because I think Tia kind of talked a little bit just about like, how different folks can work together. And I know the NAP folks are going to talk, I think, in a little bit more depth around that. We can always circle back if there are things that we want to touch on. But I think, Tia, you're going to talk about safe havens. Is that right? Or is that me?
You can.
No, you
Yeah.
go for it. Yeah, you.
So safe havens are organizations that provide support for people and pets in crisis. And we're looking specifically at pets. That tends to look like, well, where are pets going to stay if someone has to go into a domestic violence shelter or a homeless shelter and they aren't able to accommodate pets. So domesticshelters.org is the largest searchable database of DV support programs and shelters in the US and Canada. So if you go to domesticshelters.org, you can put in your location and it will pop up a list of specifically domestic violence shelters in your area. And you can see if they have options for pets because they'll have a little paw print that says pet options, and you'll see a little screenshot of that, I think, on the right side of your screen. Safe Havens for Pets is another searchable database, but this one includes homeless shelters and animal shelters as well. So if you're looking for places where a pet can stay while you go into some sort of emergency housing, whether that's homeless or domestic violence, that's another place where tons of support there. Highly recommend both.
Thanks for the assist, Tia. I felt a cough coming on, so I appreciate.
Yeah.
Yeah, yeah. I think one of the, Tia talked about having the plan of action. I think one of the most important things that any of us can do is really just to know what resources are available. I think that's kind of, step number one. And then creating those deeper collaborative relationships, those partnerships, I think are super, super key, which I think is a wonderful way to kick it over to our friends at NAP, which I think, Carolyn, are you gonna get the folks kicked off? Oh, you're on. Oh, wait. Danielle might have to unmute folks. Yeah. So, yeah, Danielle, if you could unmute our friends from NAP, sorry about that. That's one of our settings, just to allow, folks to come into the room quietly.
So I think it's important to give people a voice.
Yeah, it is.
And
It is.
now that I have mine, yes, I'm going to kick it off for NAP. And I'll start out by saying this is kind of a collision of different pieces of my world in that I am in the National Academies of Practice. And then I also heard about the Purple Leash Project through Purina, which does a lot of work with the College of Veterinary Medicine. And then met Katie in this group, and it's really been fun, and it's been a expansion of my thought process of who should be involved in these kind of activities, and it's really made me think differently about ways that we can help through all of our professions. So today there are 4 of us from the National Academies of Practice from various backgrounds. So I'm Carolyn Henry. I'm an oncologist at the University of Missouri, and I'm the director of the Research Center for Human Animal Interaction. And we have 3 others that will give a brief intro when they give their sections. But we have Lynn Jackson is in social work at TCU. Travis Retz is at St. Louis University, as is Lisa Jaggers in occupational therapy, and Travis works in speech and language pathology, and a lot of other initials there that they'll mention when they do their own intro. So if you could take it to the next slide. I just wanted to put this up here. These are all of the different academies within the National Academies of Practice. So this is an interprofessional healthcare group that comes together for reasons such as advocacy, finding new solutions to problems that cross over a lot of these different professions. And if you look down this list, kind of have this in mind as we talk through our cases, because you may not automatically be thinking of some of these professions as being something that would dovetail with what you're seeing in your clinical practice. But it doesn't take that long to think it through. And most of these, I think, will be touched upon. Athletic training, maybe not, but there may be, and that's what's so cool about this group, National Academies of Practice, is that we all get an opportunity to come together and open each other's eyes to what the different aspects of each of these situations is. So next slide. So really what we want the group to be thinking about is how can various professions, and we've got a few up here: veterinary, social work, speech pathology, occupational therapy. Those are the ones that we represent. But then there's plenty of other healthcare areas. And as students, how can you support domestic violence survivors, their pets, and domestic violence shelters while in school? So we want you to get involved early and start thinking through what impact you can have on your community, because we are all in service professions, and we need to always have an eye to what we're providing to our local communities. And what are ways to start preparing for the workforce now? What will get you ready to potentially work in these areas when you graduate, or at least have these areas in mind as you practice? Next one. So one of the first things we need to do is understand domestic violence and the related disabilities that can come with it. And I think Tia and Katie did a great job of teeing this up, having us think through some of the effects of domestic violence that we need to be alert to, and understanding how these disabilities, one, can lead to the domestic violence, or when domestic violence has led to the disability, how we as healthcare professionals can assist with that. First, by recognizing it, and then understanding how we can each work together to come up with solutions. Next one. And then importantly, we need to be having an eye towards what the client needs are and looking for signs of domestic violence. And that's going to look very different for all of us. What we're going to see in veterinary medicine is going to vary from what Travis or Lynn or Lisa is going to see. And we'll talk through that with a case example. But being alert to what those signs of domestic violence are, and then importantly, knowing what to do with that information. Next slide. So Lisa's going to present a case study, and while she is doing that, think about not just your area, but some of the other areas that we mentioned, and how we can work together in an interprofessional way to provide help for, in this case, our case study, Donna.
Great, thanks, Carolyn. Excuse me. Hi, everyone. I'm Dr. Lisa Yeagers. I'm here at St. Louis University, occupational therapist and public health researcher. So I'm just going to put in the chat a few notes about who I am, so that I can save more time for talking with you about this case study. I also want to touch on some points that Carolyn mentioned in terms of domestic violence and disabilities. There are some areas where people may be more likely to be affected by domestic violence. That could be people who have vulnerability because of a disability. They may have a cognitive impairment existing, and there's other injury risks that can occur. So we should be aware of people who may have head trauma. They could have been strangled during abuse. That can cause anoxic brain damage. Survivors may have had a history of childhood physical abuse. And pregnant women face risks not only for themselves, but also for that unborn child. I also want to touch on some co-occurring conditions that can sort of place someone at higher risk as well. That could be depressive symptoms, anxiety, and then sometimes substance use or misuse can be occurring as a result to cope with this situation. So we're going to touch on these sorts of things as we go through this case study. And ultimately, to round back to RedRover's impact here, it's that role of the pet that is going to guide a lot of this. And so we think of the pet as that anchor for healing as someone goes through this process. And so pet care activities in that taking care of that loved one, that pet that they have can become a therapeutic routine for structure and calming as someone is recovering. So, and in exploring this role, this interprofessional role, bringing folks together, all of these different colleagues that Carolyn mentioned, all these different professions. I wrote up this case study as just a way to go through some various examples. So we have Donna. Donna is a 34-year-old woman. She's a survivor of 5 years of domestic violence. She's the primary caregiver of 2 children. They're age 6 and 8, and they have a dog, a rescue dog that they love dearly. It's Daisy. Daisy's a lab mix who's been their emotional anchor throughout trauma. So, one thing that Donna is able to do in the violent situation in which she lives is to schedule routine veterinary visits where she's not going to be questioned by her spouse. Um, and in her day-to-day life, Donna also works part-time as a pharmacy tech, but because of this part-time employment, she's not able to afford permanent housing. Through the years of abuse, she's experienced multiple concussions or head trauma with lasting mild brain injury. So that affects executive function like memory, attention, processing skills, problem solving, emotional regulation, and communication. Now, as a result of physical abuse, Donna is wearing an arm sling. She has her forearm is wrapped in a bandage, and she did sustain a dominant arm, so say she's right-handed, a laceration on her right hand with nerve damage and wrist drops. So physical limitation there. And so during a recent veterinary visit, Donna appears quiet and hesitant, but she lingers to chat with staff after Daisy's exam. She seems relieved to be in this supportive environment and discloses vague comments about things being difficult at home. And in terms of her personal goals, Donna is interested in rebuilding her roles, habits, and routines, her sense of identity, and with pet care being a very meaningful part of her recovery. And to take one little step back, before her abuse began, Donna felt that she was highly social. She was active in her church. She organized her daily routines, balanced her work, parenting, and had hobbies like gardening. So all of those areas to inform our discussion moving forward.
So we go back to thinking about the various professions that might come into play in Donna's case. And if you could, maybe in the chat box, if there are ones up here that you hadn't thought about previously, but now make sense to you in light of this case, just throw them in there, because I'd like to see kind of what your preconceived ideas were versus what you're thinking about as we talk about the National Academies groups and others like us. Should have done a Menti. All right, we've got a quiet group.
I know I was going to say, if you want, Carolyn, if folks wanted to raise their hand,
Yeah,
if they had something verbal to share, and then we can unmute them. So
that
there's
works
that
as well.
option too if you want it. Yeah.
And something added in the chat, an example of athletic training, especially since you mentioned you didn't know how that would fit in.
Yeah.
He's shown how. So we don't know the other health conditions. We'll be getting that in a second that this person may have, either separate from the abuse and head trauma or because of it.
seizure disorder, that's great.
Okay, we can probably go on to the next
Yeah.
slides. Mhm.
So looking at this from the veterinary standpoint, one thing I want to mention as we look at these different professions is many of these professions are very trusted by people. So if you look at Gallup poll has done reviews of what the most trusted professions are, and almost every year nursing is the top of that list. But veterinarians are also on high in that list, and so people may feel comfortable exposing some things to a veterinarian or to a nurse that they might not feel comfortable talking about to other audiences. So we want to make sure that we have an open, safe space for Donna to be able to share any of those things. And some of it you may bring out through communications about the pet. The example here is saying Daisy looks healthy. She must mean a lot to you. Leading with that, and that she may talk about what that pet means to her and how that might be affecting her decisions at home. We can offer discrete resources. So if there's evidence that there might be something going on, if she shared something with her, you can say, we have some resources for people who love their pets, maybe going through some hard times. Would you like to see them? I also love what was mentioned earlier about having flyers in a restroom. So I think it's very effective to have a way to communicate with people in an area that the spouse or the partner won't be able to see, but to give them steps that they can take to move forward. And then if Donna does hint at violence, I think at that point you can certainly say, I hear you saying that things are hard at home. You're not alone. Many people feel this way. Again, make that a very safe space and ask them if it'd be okay if you had a colleague talk to them privately. Now, depending on your situation here in our university teaching hospital, we do have social worker. And so we've got somebody that we can refer to locally, but knowing who in your community can be helpful is another big part of that. And we have the link to the AVMA comments about what to do in these situations. It's a guide, and it's in the slides that we saw earlier from RedRover. It's important to look at that. They've got some really good resources, like a sheet that has a listing of all of the pet-friendly shelters in the area, counseling services, all of that can be listed out for those folks and give it to them discreetly. And then I would encourage you to look at the National Link Coalition. If you're questioning whether you need to report this or not, it's very helpful to go onto their site. You can pull up the state that you're in and find out what the laws are, and also the processes and phone numbers for the people that you need to get in touch with. I've had to do this myself. It's a little intimidating at first, but it's something that if you prepare yourself ahead of time to be able to do this, it'll come more naturally.
Carolyn, I wanted to say something to that. Hi,
Yeah.
I'm Dr. Lynn Jackson. I'm from social work. I do think it's really important for people to think about what you might say because, there is a tendency if someone were to hint, and if you're not sure what to do, then you just want to ignore it because you're nervous and you don't want to do the wrong thing. But the fact is if they have opened up to you, that's a real gift that they obviously feel safe enough to be able to do that. So just having the words, even if you say, I'm not sure what to do, but I'm happy to help you try to figure it out. Or if you can find out what to do, like having talked to someone ahead of time and know who you could make a call to kind of hand that person off, maybe if that's what's needed, is really important because the fact is they did say something to you, and you might be the only one that they trust at that point. So I think that's really important.
That's a great point. And that goes for, the veterinary technicians in the practice, others that might be in conversation with the client.
Right. And that really goes for any profession. We don't
Exactly.
know. I mean, we've got podiatry on there, and maybe they've been your long-term patient. So who knows, right?
Yeah, exactly.
Hello, I'm Dr. Travis Threats. I'm professor and chair of the Department of Speech, Language, and Hearing Sciences at St. Louis University, and very proud colleague of Dr. Lisa Yeagers. So in this question, when there is something that's been said and you want to ask, some of these things do need to be asked directly. If you had any injuries lately, you want to ask about these head and neck injuries because unfortunately, a person could come into an emergency room with even a broken jaw, and they will not necessarily get a brain scan unless they come in unconscious or they can answer what their name is, what day is it, and all of that. Ever lost consciousness, trouble remembering things? How long have you had trouble remembering things? Did you have any of these difficulties when you were a child? Now, it may seem odd to ask, but it would be important because we do know that people with disabilities are more likely to be abused. Um, Abusers look for people with vulnerabilities. So you may have a long-standing problem, and now there's been head injury on top of it. So we go on to the next. Understanding your unique role, to give a example of one that's not represented here but was on the list, audiology. One of the things that can happen from abuse is hearing loss because it's rupturing the eardrum on the side. So obviously the audiologist, well, they would to the physician, get the medical care. Audiologist would be doing the any hearing aid. So there'd be very specific things the audiologist would do, but they would need to communicate with the other people to know things that they, situations that they were not going to be able to successfully hear in. They may be things where they're not able to hear certain sounds of their pet if they're in another room. So it would be important for the audiologist to do their specific thing, but they have to communicate with all the other members so they'll know how to adapt to this hearing loss. So that's a example, but everybody's going to have to do it. So we'll get to that on the next slide. So we are representing the people who are on this call, but not all of the people who would be part of the rehab team. So the we start with the veterinary medicine, and that's actually been talked about quite a bit. The pet well-being, connection to the person's well-being. They really can't be. Uh, um, they're so connected. Social work has been talked about before. Um, in occupational therapy, there's the actual taking care of the pet. Now, remember, we have a specific case here. And so the arm issues, as far as the nerve damage, there's specific physical things you have to do in order to take care of a pet. So the strategies for if you can't do it in the usual way, how can you make sure all your pets' needs are met, as well as the other needs for their children and how to coordinate between taking care of all of those things. Speech language pathology, we're working on cognitive uh, memory, problem solving. Unfortunately, sometimes the reason that these people do not leave the abusive situation is because of the brain injury that limits their ability to problem solve and uh, um, how to get out of the situation. And equally as important, of course, is that they, and this is what the team is involved with, that they successfully not only go to the shelter, but not go back to the person who abused them or get into another relationship with somebody who abuses them. So it's very important that we get all aspects and that the pets are going to be part of it to reestablish themselves to stay out of the situation in the future. And that's part of that long-term rehab. So it's not just we got them away, but again, not going back or going to a different person who does the same thing. And work stability and all of those things are going to be very important. So the shelter, health providers, there are obviously going to be legal issues, their employer, are they able to still maintain their job? Is there going to be flexibility in the job? And in addition to the pet, there's a 6 and 8-year-old that has to be taken care of. So there's a lot of responsibilities, and everybody on the team has specific tasks in helping them. but the communication with the rest of the team to make a coordinated care. That's the key, the coordinated care. Not just you do this, but what are we all going to do together to make this person have a functioning life, a better functioning life going forward, and the ability to sustain it. Anybody else want to add any to this slide before we move on?
If I could just add about shelter, from a veterinary perspective, we're looking at shelter for the animal as well as shelter for the survivor and her children. And if you're looking at how can I help as a student right now, some of the efforts to provide pet-friendly housing in these situations are what we're doing with RedRover. You have to be very careful, though, that that pet is protected and that as it was alluded to earlier, that the partner or the spouse can't use that pet as a retaliative measure, that we get the pet safe. And sometimes we'll see the pet abuse before we see the abuse of the family. So veterinarians need to be especially attuned to those kinds of injuries and make sure that we're reporting them when necessary.
Right, and I want to also add that the injury to the head, that's sometimes on purpose because the hair covers it up. And then the strangulation cases are going to result in brain damage too. So even questions about your voice seems a little hoarse today, have you had any injuries to your neck, people may not be forthcoming with the details, or they may not even realize that the abuse is having these effects on them. They may not know that. So they may be actually very critical of themselves for not getting out of the situation, not realizing that the brain damage occurred from the abuse is the thing that's making it hard for them, and that they need to accept help to 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 do that, and it's not simply a personal weakness, which is and then of course the abuser is driving that home. So that feeling of helplessness, I'm just not very smart. All of those things are being driven home by the abuser. The injury is actually causing some cognitive problems. So it's very important that they know that they have more agency here than they think, if they have a team that can help them to get better.
Yeah, one thing I would say too is that as we all know as professionals, it's always important to keep constantly assessing what's going on because things could change really, from week to week that we're working with people. The kids might be all situated in school one week and then something happens and there's a crisis and things would change. So that's when we're talking about the additional contextual supports is just um, making sure that we're kind of keeping in tune with what's going on, what the changes are, but also understanding that from each profession, there might be a different focus on whatever the issue or the problem is. And that's okay too, because that's the whole idea of if we're working together, then we're working for the betterment for this person that we're working with and the family to, try to get them to the place where the issue is resolved. So that's okay. But through the assessment, we're going to learn if there's legal problems, if there are healthcare issues. Initially, it might not come up that this person has diabetes because things seem to be managed, and then they're in a new environment and maybe they're not eating regularly, and all of a sudden something happens. So, all of those things we just need to be attuned that that's another reason that we may be bringing in other professionals. And also, I don't know anything about dietary stuff necessarily. So it is going to be important, right, for me to make sure that I'm asking some questions or reaching out to my colleagues in other areas because I know my profession well. I don't know the others.
And their children could have different needs that they're dealing with, that you would need to make sure that somebody's reaching out to that child's school to see what's going on in school for their functioning. On to the next slide.
So if, as we look at the context in which we're each going to be experiencing these, we can think about how we work together with the pets and pet-centered care. All of this is going to be trauma informed in terms of our response. So Travis had mentioned earlier about safety and predictability being important in these cases. They want to feel like they can have consistent routines, and we're going to have to help with that in terms of their ability to set up those routines, stick to them, remember them, and have clear communication across all of the disciplines that we have here. It's important that they have choice and they have empowerment. In this case, Don is able to direct priorities, and in those, they may be pet care and parenting, where are those going to land in terms of her priorities, and then work readiness. So we need to make sure we're looking at all these issues that she's going to need in the future. And then Lisa, do you want to talk about kind of the communication across teams and how we can align that in this trauma-informed care?
Sure, absolutely. There's wonderful community models based on that. One is the ACT model, assertive community treatment. That's more for mental health spaces, behavioral health. However, we can lean on that to see it as a model for how do we come together. If say I was kind of thinking about how does this look? You know, how does this actually happen in or with veterinary clinics? And me being a community practice occupational therapist, working with people formerly incarcerated, victims of crime who've come from one space to another, having to transition from doing one part of life to a new one. We partner with all different service agencies. We talk with other healthcare professionals, all of those community service providers, and we try to stay on the same page so that especially the client, patient, the person does not need to rehash what they're going through over and over again. That is re-traumatizing. So that in itself is a trauma-informed practice. And it can be a model for how a clinic may ask folks or how a practitioner may ask folks about their past history, background, and ask those questions that we posed earlier. So that's just one example of how to be collaborative. There's ways of documentation, note taking, note writing, sharing the referral with one another so that it reduces, asking the same questions over and over. But ACT is one example. I put in the chat. Sam's a resource on that as well.
That's a great one, yeah. And then through this all, we're remembering that Daisy's really been an anchor to her, and we can take advantage of that relationship, and that Daisy's going to help her cope with the day-to-day issues that she's having. She's going to give her a sense of routine in terms of caring for her. Social reintegration. Nothing brings people together quite like a conversation about your pets. And helping figure out how are we going to transition into a different living lifestyle. How can we make sure that they have access to housing that is going to be pet friendly, and how can we help along that way? I think next slide. So some of the things we need to think about if they're going into a shelter living environment is, first of all, privacy and autonomy. So we need to think about how we can be helpful, but also respect each person's independence. And that's going to look a little bit different depending on what the communal spaces look like that she's going to. Need to have consistency. So it's important to have structure and routines, and that's probably even more critical in transitional housing because we want to try to reduce anxiety. As I said, Daisy not only supports Donna's coping, but she provides a sense of normalcy for the family, and that's going to have a positive effect on the children. And hopefully many of you are familiar with the 20 by 25 campaign, which is works between RedRover and the Purple Leash Project to make 25% of domestic violence shelters pet friendly by the end of this year. Those are the kind of things that we want to see happening, and those are certainly things where students can can play a role. And then I invite others on this team to talk about the transition planning from the perspective of your profession.
Well, it's the beginning. This group is handling the crisis at the moment, but it's who you hand it off to, and having those relationships with who to hand it off to, what kind of settings, because you're only involved in this particular one for a relatively short time, but you do need to. But those things need to be already in place. So it's not like, well, I have this, but who do I go to? Those relationships need to already be there. And there needs to be, it would be good if there's a way to have the continuity where you can follow up with what they're doing, or maybe have a quick Zoom conversation for them to know that you've handed them off, but you are concerned about them for the long term. And that's very important that they think that this, and sometimes in medicine, they think that people are just interacting with them at the moment, but that they're not concerned about them, how their lives turn out. And
That's a great point.
that belief in them, because remember, this is what's being shattered by the abuser, the belief in yourself and your future. So that is as much a part as the technical things we do, is that look in the eye, that concern that you deserve better, and you will be better. And there's all these people out here who want to help you. And the pet is part of that, because the power of the pet is non-judgmental. The pet is accepting, and that is why that's important. And also the pet, as I said before, gives them a sense of purpose. I've got to get better because this pet needs me. So I've got to keep myself together. And the pets and my children. I need to get out of this abusive situation, not just for me, but for my children and my pets.
And
And
oftentimes they'll choose care for the pet over care for themselves. And so if we
that's
can
right.
be paying attention to both of those, and more we're seeing communities for our unhoused that are being set up with these different areas all incorporated in that space. So for instance, we have one in Columbia that's going to be the Opportunity Campus, and it will have mental health resources, it will have career resources, it'll have human and veterinary care resources. So I think, to your point of having it all ahead of time, I think the more we see those types of facilities cropping up, the better we're going to be able to address all of these needs.
Absolutely. And I think that in this transition piece, as we shift to the summary of our presentation today in the next slide, it sounds like the veterinary clinic in this experience could be the core of how we are able to reconnect once, receive that referral as an interprofessional partner, and then reconnect with the client when they need additional veterinary services for their pet. So I think the warm linkages to each partner in this interprofessional space is huge, and that we are able to reconnect back to that initial referral source to perhaps gain new information, inform what we're doing next with our client in case we don't have access to them as we'd like to. And so in our services, what we do for occupational therapy services, we use a lot of telehealth. We use text. And so in this case, we need to figure out, is it safe for us to text this client? Do they give that permission? We might use FaceTime. We might use a HIPAA compliant telehealth Zoom version. And so we try to make it as easy as possible for our clients to connect with us. So I think, yes, if we can advance to the next slide, I'll just kind of wrap this up so we can open it up to questions as well. But thinking about each profession who is here, think about the skilled services that you can provide currently or in the future, if we have students here, and consider what is the distinct value that you bring to this partnership. And you saw in Donna's case, I'm sure you were thinking about, oh, I'm sure I could help with that. I'm an OT student. I can make a splint for her wrist drop situation. I can make an adapted leash so that if she has poor hand grip, it's fine. It could be hooked on her belt so that she can still walk the dog. Cognitive strategies for those speech, language, hearing sciences folks. How can she better articulate processing, cognition, and so on? Social work, maybe there's a counseling session where the social worker is thinking about the context. Let's do a walk and talk. Let's walk the dog and talk through the counseling things. So this slide gives you a snapshot of many of the things that the interprofessional group team can be working on together, utilizing their distinct professional qualities based on, client informed goals. This is tailored based on what Donna needs. Pet driven goals. This is based on what the pet needs, her family needs, and so on. So you can see social participation is huge. We know that can reduce areas of depressive symptoms, improve mental health. Communication is huge, especially for someone who has the mild cognitive challenges that Donna is experiencing, along with executive function. And then the psychosocial and support will get her through the long run. So I want to note that when you receive the slides from today's presentation, the notes section of the slides, I don't know if you can see it on my screen, but the notes section has a full mapping of what each practitioner could bring to the table just based on a brainstorm. So you could use this in a class discussion. You can, have a group meeting about this at your own college or university or organization. And we would be happy to contribute back to your discussions as well if you'd want more direct information on that. So I think our last slide is about a call to action. So based on what you've learned today, consider who can you connect with on your campus or outside of your campus. So in the work that I've done with people who've been victims of crime, who have experienced incarceration, we have 100 or more connections across the local St. Louis community. One especially is our integrated health network. It's amazing. And seeking out those partners, making those partnerships, meeting people like how I've met Travis Threats, how Anthony Breitbach is here on the call, professors across our university from law, from social work, all these different departments is enormous. So growing your network, growing your team is a big piece of the puzzle in being able to make this happen. So I'll open it up to our team here and see if you have anything else you'd like to add.
One thing I would just say is that you heard from the beginning when Katie and Tia were talking about this whole idea of helping to make shelters pet friendly. And what we've also been talking about is this ability for, what you might do if you're working with this population by your profession. So this idea is when you're thinking about this is you may be at different stages right now. You might not feel like you could go in and provide professional services, but what could you do maybe to help with this initiative in your area? Maybe it's to help get something started, bring some training. Maybe it would be to help if someone's already doing something. Missouri's about to do something. Maybe it's to go and volunteer on the day when they're going to help build out something. Maybe it's to fundraise. So that's what we want you to be thinking about is what kind of sparks your interest and your passion around this area. Oh, I love this, what the ideas that you all are bringing so far. And feel free to put this in the chat too if it's better for you.
This one might be my favorite with all the acronyms.
I like this, the dentist, because there's often damage here, and this damage orally and all of that is a big part of your self-concept. So, you have to think so broadly for a given person, what might be upsetting them, and that's why you reach out broadly, because for different people there may be something that's particularly hard on them, and you've got to ask enough questions to know that to get them to those people.
Yeah, there was some really interesting research that came out a few years ago, and I believe dentists were included in it. But barbers or hair stylists are
Mhm.
also listed as one of the professions that are most likely to hear of domestic violence, to have a survivor
Mhm. Mhm.
divulge to them. So I love everything that you all shared, and it really, I think, brings home this idea for me that we're all absolutely serving the exact same population. Whether we come from the human side or the animal side, we're all we're serving the same folks, y'all. I love it. This is awesome.
Alpha Chi Omega, that's a sorority that has domestic violence as one of their areas that they concentrate on, Correct?
Yes.
Yep. Yep. Dr. Henry, there you are. Back with you. I love it. I'm just looking at the time. We have about 5 minutes. We have a couple more just really quick info slides to just share with folks. And then I know we want to leave time for questions. Is there anything else you all want to call out with this before we just share those slides real quick? Okay, cool. As mentioned, the 25 by 2025 movement, it is almost done. Hard to believe that we are almost at the end of 2025, but the website is still there, of course. What I would call out, I think, for this group is that there's just a ton of information, sample letters to the editor, sample emails, sample social language that folks can use to just raise awareness around this link between human and animal violence and the importance of recognizing pets. So lots of great information there. We will have a final, what we call a wrap up 25 by 2025 call in the new year. So probably around February or March. So definitely stay tuned for that. I'm going to turn it over to Tia to talk really quickly about our RedRover Responders Volunteer Program.
Thanks, Katie. As we mentioned at the very beginning of this presentation, Red Rover Responders is one of Red Rover's 3 departments. And through our Red Rover Responders department, we go on just a bunch of deployments throughout the year. And those tend to be within these 3 separate buckets. We go out to domestic violence shelters where we partner with Greater Good Charities and we help renovate on site. And you don't have to have any experience, as I know personally, with a hammer or a wrench or power tools because they will teach you. And then you will be very confident to renovate your own home. We also deploy out to emergency response situations. That tends to be natural disasters or large scale cruelty and neglect cases where we partner with larger organizations like Humane World for Animals. And then we also have our community programs deployments where we go to communities across the country and provide mobile vaccine clinics, trap, neuter, vaccinate, release deployments. And we also do unchaining where we go to communities and we actually build fencing on people's homes so that pups are able to get off of chains.
Thanks, Tia. Lots of great opportunities there. And then finally, we just wanted to make sure to give you the website for the Don't Forget the Pets project. This is a collaborative project between Red Rover and Greater Good Charities And we essentially provide free training. We do workshops in person where we can. It was so great to have Carolyn attend one, Lynn's attended one. They're honestly one of my favorite things to do, to bring together folks from the human services world, the animal services world, and the veterinary community into the same room to talk about it. So we do those in person. We also have a online course that you can take virtually, go at your own pace. Brand new for us. We have a whole bunch of guest presentations. I know I mentioned one earlier with our readers team. And then we have document and video libraries on the website, as well as coaching. So free technical assistance for organizations in creating this kind of programming. So lots of wonderful resources available there. And with that, I'm going to stop sharing. And I'm going to make sure to pop my information into the chat as well. Danielle, I think we might have answered the questions, the couple of questions that came up in chat. Is that true, Danielle?
Yes, from what I can see, I don't think we have any unanswered questions.
Okay. Are there any verbal questions that folks would like to ask of our wonderful group here? And again, I think you might be muted, so you'll just need to raise your hand and then Danielle can unmute you. All right, I don't see anybody hopping in. So I think I'm going to ask a question of the panel, of our panel from NAP. I know they're so not prepared for this. What is, short answer, what is the one thing you hope attendees take away from today? Um, I'll let you all decide who goes first. I was going to say I could do it for you, but that feels mean because then I would just be calling on you all. So, what's the one thing you want attendees to take away? Lisa.
I would love for attendees to feel empowered, where having this ability to recognize the signs and symptoms of what may be going on and to have specific ways to support or refer someone or advocate for them would be an amazing way to move this forward. So thanks so much for this opportunity in this format and allowing us to join today.
I love it.
I love that. I would say too, what I'm hoping is that everybody realizes there is something that you can do, small or big. I mean, small really. There's things you can do, and they provided a couple of great examples that you can do. I saw someone said, "Sign me up." You've got the website, you've got the ability to do it. So I hope people will do that and know that you can start things in your community too. There's a way to do that. And you can reach out to RedRover if you're interested in that, because there's probably partners they can link you up with.
It's awesome. Thanks, Lynn.
I do have to admit, I thought that what you were going to say, putting on the spot is, so how much are you willing to financially contribute today? Because that's usually what people do at the end, after they got people all involved. So what are you going to pledge?
I missed that, Travis. That would have been a great opportunity.
Okay. Anyway, I think this is a population that people know about abstractly, but they need to understand more and feel that they can contribute.
And I would say share the information.
Yeah.
It's going to be the greatest pyramid scheme if we can all reach out to our own networks.
It looks like Tony Breitbart has his hand up.
I love that, Karen. It's going to be a positive pyramid scheme.
Yeah, I just want to say hi, everyone. My name is Tony Breitbach. I'm the president of the National Academies of Practice. I really appreciate you all coming together to do this great work. I think, what I hope I have NAP members get out of this, that meeting people where they are to provide the care they need, to deal with the challenging situations they're in. I think and engaging with maybe colleagues that you don't think of firsthand. And I think it's really important that we keep an open mind, we be innovative, and we really, focus on being person-centered and animal-centered as we move forward, and both of those things go together. So thank you all for doing this, and NAP is really excited to be a part of it. So thanks.
That was great. Thanks, Tony. I'm so glad you're able to join. Yeah. I know we're at 2 minutes over. My dogs have told me that it's 2 minutes past the 4 o'clock hour, which is not actually their dinner time, but they are convinced that is their dinner time. So I know folks probably need to go, but NAP folks, any final thoughts from you all before we depart?
No, thank you so much for joining with us, Katie and Tia. Danielle, we really appreciate it.
Yeah, ditto, right back at you. And just a huge thank you to everyone who was able to join us and everyone who is going to be viewing this recording after the fact. And, I think it goes without saying that there is a wonderful group of folks here today who share just a wealth of knowledge with you, who would just love to, I think, support you in these endeavors moving forward. I will speak for myself, going out on a limb for everybody else, but I think they would agree with that. So thank you, thank you. I know it's past the hour, so we will go ahead and end it there.
Thank you.
Thank you.
Thanks all. Bye now.